Megan. I'm an embryologist at Care Fertility, and I'm going to be talking about optimising embryo culture conditions and our experience with Kitazato high viscosity oil. Moving on to the benefits of a high viscosity oil. So high viscosity oil reduces medium droplets breaking and fusing and oil spillages during dish transportation and handling. It's suitable for extended culture without the need for dish changes, and it provides better embryo development. It maintains the temperature and the pH of the drops, which is really important. We know that cooling, especially for oocytes, are very sensitive to cooling. It can cause disruptions in meiotic spindle. It can also affect meiotic divisions in embryos, and we also know that unstable pH can affect embryo metabolism. One of the other benefits of a high viscosity oil is that it can reduce evaporation when our dishes are cultured in dry incubators, and by reducing evaporation it can reduce the rise in osmolality after 7 days of culture. Moving on to the Kitazato High Pure Oil Heavy. So it's a high quality paraffin oil that has been pre-washed with ultra pure water. And this is to reduce toxicity, remove endotoxins, and also to prevent it from absorbing critical components of the culture media. So as you can see from the graph, there's a number of different oils here at different viscosities. It's important to note that there's not a clear threshold to what we class as a high viscosity and a light oil, but as you can see, the Kitazato Heavy is up there with the highest viscosity of the oils on this graph. So on to our experience at Care Fertility. So I'm going to just talk a little bit about why we wanted to introduce this oil and then our experience since introducing it. So Care Fertility is a leading IVF provider. It is worldwide, and we have over 23 clinics and satellite clinics in the UK, and we're always striving to produce the best results for our patients. So at Care Fertility, we implement understabed culture with single-step media. We previously used a combination of a light oil with a heavy oil for culture dishes before switching to the Kitazato High Pure Heavy Oil for all dishes. Across Care, we utilised the non-humidified time-lapse embryoscope, with some of our clinics also having the time-lapse humidified jerry. And this has prompted my STP project, where I wanted to compare the osmolality change in dishes in both of these culture systems. As you can see from the graph, there was a significant increase in osmolality in the embryoscope compared to the jerry, and notably the osmolality on day 5 to day 6 in the jerry remained stable. So I wanted to look at our patient results in each incubator. I looked at clinical pregnancy rate, implantation rate, utilisation and blastulation rate. I didn't find any significant difference between the two culture systems. There was some significant values, but they followed no clear pattern. There was some significantly better results in the embryoscope and some in the jerry. But it does just show that both of our culture systems are really robust and give us very comparable results.